Community investment, otherwise known as place-based investment, helps create the social and physical environments that support community health over the long term. Hospitals and health systems are using this anchor mission strategy to address housing insecurity and other social determinants of health and ultimately advance health equity. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hitterly with AHA Communications. To learn more about the strategy behind healthcare organizations' commitment to community investment, Beth Kenefick, Senior Program Manager with AHA's Population Health Team, speaks with Ray Prushnock, Executive Director, UPMC Center for Social Impact and Associate Vice President for Government Programs at UPMC Health Plan, and also Rob Koenig, Senior Director, Strategy and Operations with Boston Medical Center. This podcast is part of AHA's series, Community Investment, Conversations with Senior Leaders.
Thank you, Tom, for that introduction. And Ray and Rob, thank you for speaking with me today. To get started, UPMC and Boston Medical Center have both made significant commitments to the economic health of their communities, including for affordable housing, but with different approaches. Ray, could you start and give us a quick overview of what UPMC's role and commitment has been in the Pittsburgh area?
Thank you so much. I'm Ray Prushnock. I work at UPMC Center for Social Impact, where we work on social determinants of health. And our organization has a long history defining health broadly and working on our overall community health, including going back to 2007, where UPMC made a $100 million commitment to the Pittsburgh Promise in education. And we've long had charitable giving that corresponds with our role as a safety net insurer and hospital system. And where this began, we've had a history in supportive housing for members who are unhoused and connecting them with community services, where we've had an impact for about 12 years. And through that, we learned about the Accelerating Investments in Healthy Communities program, where we really were able to refine our overall strategy and connect not only how we partner and how we give, but also made strides in how we invest. And in this past year, through the program, we made a commitment of $15 million specifically of program-related investments to support affordable housing in our region. And that complements a variety of other strategies, including sponsorship of single room occupancy and drop-in beds, to long-standing commitments supporting shelters, nursing home transitions, and support for CDCs and other organizations here in our community.
Great, thank you. And Rob, Boston Medical Center is a critical anchor for your community as well, although your approach to housing investment has been a little bit different. Can you tell us about Boston Medical Center's role in the Boston area?
Yeah, absolutely. So I'm Rob Koenig. I'm on the strategy team at Boston Medical Center Health System, and we are a nonprofit integrated health system, which is comprised of about a 500 licensed bed hospital based in Boston's South End. That's the largest safety net hospital in New England, and also a 400,000 member health plan focused largely on Medicaid members, mostly concentrated in the Boston area, but with scope across Massachusetts and New Hampshire. And as a system, our roots are really as a public hospital. Our origins go back to the public hospital, or the city hospital for Boston. That orientation toward public service and really serving as a safety net provider is really woven into the fabric of our operations and woven into who we serve and the role housing and homelessness, as well as other social determinants of health, play for our patients. So I think that has a profile of patients and members in our system has definitely impacted the way in which we think about and feel committed to and responsible for a community-based approach to addressing those social needs. Just to give a sense, homeless patients represent, or about 6% of our members are people experiencing homelessness, and about 10% of our inpatients in our hospital at any given time are experiencing homelessness. The pressing and urgent challenge of housing and homelessness are really visible to us, even in the day-to-day work that we do on behalf of patients and members. What we've done is take a couple of different approaches related to affordable housing and permanent supportive housing. Over the past several years, with determination of need funds that we have to deploy for community benefit purposes, we've deployed them in affordable housing developments to help bring those affordable housing developments online. At the same time, we've also worked on building pathways to permanent supportive housing for patients and members so that they have readier access to housing opportunities than they might otherwise have. So we've kind of taken those two approaches, really informed by what we see in patient population and community needs.
Great, thank you. You both have outlined a number of amazing commitments that you've made to your areas. And one of the things we've seen is that a critical component for success long term is that your community investment in these strategies are aligned with and eventually sort of become an ongoing part of your health system and health plan's larger strategic plan. So, how do you see community investment aligning with your organization's broader mission and strategic direction? And Ray, if you want to go first.
So within UPMC's mission and vision statement, we are, always seeking to put our patients, our members, our employees of the community at the center of what we do to make sure that every patient gets the right care, the right way, at the right time, every time. And that work is impossible when you're not addressing some of the underlying barriers to care and social determinants of health. So this work fits in squarely within that agenda and is really, I think, a great example of how a community institution can, help work on these issues, but it really does require, braiding and working, across systems. So in our case, we look at our alignment with both, in terms of how we give charitably and, across our entire impact. So supporting community development corporations and other, community benefits. We also look at how we partner. So we have invested deeply in community-based organizations who support our members, whether it's transitioning from a nursing home into community-based housing and having, housing navigators on staff, or helping members who are experiencing homelessness navigate a complicated housing system, get them attached to a community human services agency who then is able to support our member in that journey from finding a house to supporting them in tenancy longer term. And lastly, in terms of investment, our first commitment, again, $15 million into affordable housing in Pittsburgh. That investment is also, an area where we're excited to see where we can build evidence that by making, investments like this, we can impact health, quality, and cost over the long run as we look at how these investments then impact members' health and employee health and, the health of the community at large. So it is a critical part of our larger strategic plan, and this type of community investment, I hope we see continue grow in the years to come.
And Rob, how about with Boston Medical Center?
It's an important question, and I think the way in which at BMC we think about the kind of link between our community investments and our longer term strategic plan, I think it comes down to a couple of related factors. The first is one I already mentioned, the patient population we serve, where we know for that patient community and member community, we have to think beyond the hospital walls in order to help promote the best possible health outcomes for patients and members. And so I think it puts front and center for us thinking a little bit differently from traditional health system about how we center community investments and programs that address in a related manner social determinants of health in our overall plan. I think the second thing that comes to mind is a bit unique to our role in Massachusetts. I mentioned we're an integrated health system, and within Massachusetts, most of our Massachusetts Medicaid members are members of our accountable care organizations. So we have about 200,000 individuals, or just shy of that, who are enrolled in accountable care organizations that we help operate. And the model for us enables longer term and more holistic view of patient and member care that helps us actually think about the non-clinical factors as well as clinical factors in a patient's care. So I think an example of that is our ability to work with partner organizations to fund programs in nutrition and housing that may have an impact on member quality or total cost of care measures, in addition to being the right things to do for patients. So I think there's a bit of policy context for us that has actually helped us ensure that it stays front and center of our strategy as an organization.
Great, thank you. You both identified how it fits into your strategy, but a key part of that is getting leaders on board, engaging and integrating senior leaders and board members into this type of work. How has the role of leadership evolved in your organizations, and what outcomes or impacts are becoming most important to leadership and the organization as a whole?
Leadership is critical in making this type of project work. And I think similarly as an integrated delivery system, we have variety of leaders that are engaged at different points. And what it sharpened for myself and our team and UPMC Social Impact has been really our case making and tailoring those cases and sort of building out robust plans that really helps to lay that groundwork. We, of course, socialize this work, from president of our government business in the health plan through our health plan CEO and CFO, our chief investment officer, and members of our board. And this wouldn't have happened without their buy-in and support. But creating and sustaining this is also in part why we created this new department, the UPMC Center for Social Impact, in order to have a place where we can continue to engage in this work. And something that I learned very quickly was that people in housing speak houseish and people in health speak healthish, and the two shall never meet. And so understanding and through this program specifically building our bench strength in terms of articulating housing issues in that health context and understanding the mechanics of housing finance can be very complicated. So you need that sustained institutional trust in order to be able to advance these issues. And once you've advanced them, you have to really know your audience and be able to direct your responses to their interests and their requests, and also sort of taking out a lot of the complexity that happens sort of behind the scenes in any housing project. So it's a journey, and by no means are we done, but I think this has been a great example within our integrated delivery system of collaboration between the payer and provider side that aligns what we do from a community benefit standpoint to what we do from a health plan and patient and member facing standpoint.
Great, thank you. Rob, anything to add from your point of view?
Yeah, a couple of things that Ray said resonated with me. I think the first was the importance of kind of building out a team and building out that bench as you described it, which is critical. I think for the second reason, as you mentioned, it takes that bench a bit to be able to bridge the gap and cross silos that are critical for community investment, particularly in housing and affordable housing, where we've had a similar experience of realizing we have a lot to learn and that takes investment and capacity on our side. I think another thing related to what Ray described that was on my mind with regard to leadership buying, which for BMC has been really substantial and critical to success, is that it helps us take a longer term view on things as well. I think there are places where investments and collaborations with community organizations can take time to come together, have learning curves, and can take time to actually see results. And so having the patience to be able to look with that longer horizon is really critical. And when I think about the different dimensions that our leadership is thinking about and tracking in terms of the impact that we're having through investments like this, there are kind of four criteria that come to mind that have been helpful for us. The first is just thinking about overall fit with mission and purpose of the organization for community benefit. The second is evaluating through and assessing through the lens of quality and the effects we can have on quality of patient care or member experience. The third is just financial health and sustainability. And then fourth, and one that we're focused in investing on increasingly, is equity, and thinking about our investments in this space more broadly through an equity and in particular a racial equity lens.
That's a good segue because as we sit here, it's impossible to talk about strategic plans of health systems and health plans without recognizing the ongoing impact of both the pandemic and the social justice movement in the US. Certainly, both have illuminated and exacerbated the disparities we have in our communities, including pandemic related housing instability. As your organization shifted to manage the delivery of care to individuals affected by COVID, how has the interest in or commitment to community investment changed in the last 18 months? Ray, if you want to go first.
Within the context of the pandemic and after the murder of George Floyd, it really awoke a much broader interest into social determinants of health and what was once I think just a talking point for many organizations. And for UPMC, we had done many things in less of a coordinated and less of a deliberate way. And I'm very thankful that we participated in AIHC, which then led us to being prepared to respond. We we're in decision making stages on how to get engaged. And also, it really helped give momentum to understand how these types of catalytic investments can move us forward. So within that context, we've certainly accelerated and changed the way that we've participated in things like housing. Similarly, looking at ways where we can begin to address many of the health disparities that we've known have been there for years and years, but targeting our investments more broadly. So how do we coordinate our tax credit giving and our charitable giving and our housing investments in the same neighborhoods where we know we have density with Medicaid members who are facing some of the greatest health disparities, especially amongst people of color. So those are some particular areas, but then there are also some things where we've partnered with community-based organizations more actively to help reach our members on issues such as vaccines. Similarly, we've engaged during the pandemic with an organization that helps us connect our members to state and federal benefits they qualify for, but they may not be enrolled. So things like SNAP and WIC and LIHEAP and our state's property tax and rent rebate program. And we've also initiated a program recently here in Pittsburgh to help our Medicaid members get enrolled in the emergency rental assistance program. So these types of conversations have long been happening. This type of braiding has long been on the table, but the importance of it and the urgency of it has enabled us to do a lot more quickly in response to our community needs.
Thank you. And Rob?
A lot of what Ray said resonated. And I think that as a system, we've been in the past just over a year, really through the lens of the impact of COVID and following George Floyd's murder, been making additional efforts and investments around racial equity in particular, with equity more broadly. And I think what we've been trying to do, big picture as a system, is measuring where there are inequities or where we observe inequities, and then prepare to make investments and operational changes for us and for our community to address them. And think where that connects back to the partnership we were able to have through AIHC is just thinking about housing affordability and homelessness as intersectional issues with race and racial equity. And just thinking about in Massachusetts, the rate of homelessness among Black people, I believe, is about 6 times what it is among white people. And so I think there is a charge there from an equity viewpoint of making sure that we are doubling down in efforts like this, informed by what we've learned through AIHC, in order to address that inequity as we see it in our patient population and our community more broadly. I think the other thing that has underscored the importance of work beyond the hospital and health system walls for us is COVID also laid bare for us the degree of connection between housing and health like never before, where we partnered closely with homeless services providers and the city and the state in Massachusetts to try to prevent infection of COVID in homeless shelters, to operate a COVID positive recuperation facility for people experiencing homelessness, because that was going to be a need in a pandemic like COVID. And work had to come together quickly and very collaboratively. And I think it's a place where housing status clearly had a relationship with or an intersection with vulnerability to COVID and kind of drew us all or brought us all together. And I think that has actually been an important galvanizing force for us as well.
Great, thank you. I know we've covered a lot of topics in a really short time, but with 1 minute left, what one piece of advice would you give other leaders that are starting to begin this work? And Rob, if you want to go first.
Yeah, glad to. I think a reflection that comes to mind for me about our journey is that building bridges takes time and takes effort. And so being prepared to put in the legwork, look for kind of shared interests and opportunity to change things that have been siloed or haven't worked as closely together in the past. That's been something we've tried to do and has been an integral part of our path.
Yeah, to jump in there, I think that, as other systems look into this work, it was stated by Rob, time plus persistence is an incredibly powerful combination. And, as the saying goes, luck comes to the prepared mind. So, if you can be prepared, develop a plan, find places where it aligns with your business interests, with your mission, with your overall goals of your organization. And then in addition to that, I think now is the time to be developing these plans, but don't expect to be going it alone. Braiding is central to all of this work. I think what we learned about was how much leverage can come into any housing deal. You can be that catalytic investment with, a relatively small amount over, compared to the overall deal, but help get it off the ground in some cases. And similarly, as we braid things together, like the things we do on the insurance services side with HUD vouchers and intentionally finding ways to develop partnerships in new counties to braid our supportive housing services around those services, or as I mentioned before, things like benefit access. So don't think you're out there alone. Join, the existing parade. Get out there and get in it. There are others out there that are, pushing towards the same fight.
Thank you both. I'm going to remember that time plus persistence is a powerful tool. I think you've both given us all a lot of things to think about, and I think valuable lessons for others in the field. So I thank you, Rob and Ray, for sharing the Boston Medical Center and UPMC's story so much.
Thank you for the opportunity, Beth.
Thanks.
Thank you, Rob and Ray, for joining us and sharing your organization's story. And thank you to our audience for listening to this great advice that was shared. I encourage you to check out other podcasts in our community investment series. You can find these and additional resources at aha.org/communityinvestment.